Hello, I'm going to be demonstrating tracheostomy care as well as tracheostomy suctioning, but first I want to start off with the equipment. Any procedure you want to be prepared because this is a sterile technique and you don't want to get into the room and then forget something. On this table, and this is a typical overbed table that we use all the time, I've got a pair of clean gloves. I've got some sterile normal saline. Remember, normal saline, once it's opened, is good for 24 hours. It should be dated and timed. I've got a pair of goggles. However, if you have a mask with a shield on it, you don't need the goggles. I've got a tracheostomy care kit. This will be used to actually clean the stoma as well as putting the ties on around the neck, all the cleaning you need. It does have a pair of gloves in there, but those are kit gloves. They're vinyl gloves. If you do not like kit gloves, you may bring your own pair of sterile gloves in there. Most of these kits have the same items in them from hospital to hospital. However, you have to be prepared because you may learn on this type of kit, but then you get to MUSC or McLeod's and their kit looks different. If you know the basics of sterile technique and the procedure, you will be okay. You just have to think outside the box, I guess. I also have a pair of scissors that I may or may not need, but to put the ties around the neck. The reason I mentioned that is this is a Velcro neck securing device for the tracheostomy that most patients need rather than the ties that you'll see me removing around the patient's neck. This is much more secure. Also on this table, I have a tracheostomy suctioning kit. Sometimes they call it cath and glove. Inside here are a little contraption to put the saline in, sterile gloves, and the suction catheter. Again, these are kit gloves, but they're usually large. So if you have a small hand, you may not like kit gloves. And then I have a towel, and you'll see what I'm going to use that for. Also, in preparation for tracheostomy care and suction, you want to elevate the bed to a height that's appropriate for you, and you want to lower the side rail closest to you, all the while thinking patient safety. Other things to get prepared for is, this is an ambu bag. Now, not all patients who have tracheostomies need supplemental oxygen. I've taken care of many patients who, let's say they came in with a broken leg, but they happen to have a tracheostomy. They have no need to get supplemental oxygen. This is if it's indicated for your patient, but I will show you how it works. This would be hooked up to 100% oxygen, and this is how we ventilate the patient. And you will see when I do this how to properly do that ventilation, right? This is our suction apparatus, the vacuum. The sputum that I suction out of the tracheostomy will go into this device. This is the suction meter, and I would turn it to medium suction between 80 and 120 millimeters of mercury. But just medium suction will be good. I also want to elevate the patient's head to about 45 degrees. The patient's head is elevated to approximately 45 degrees, at least the head up position. Also, I want to talk a little bit about the tracheostomy itself before we even get started. I'm going to put on clean gloves because a lot of students don't really know what we're suctioning. So with clean gloves, let me tell you what you can touch. These are the ties that come in the kit, and we may or may not use them. I'll probably put the Velcro device on. This base right here, the ties are attached to that. This is what keeps the patient from coughing the whole apparatus out. Remember, this is their airway. They don't breathe the way a normal person would breathe. Their airway is right here. It's an artificial airway. An artificial airway naturally does have some secretions, but sometimes if they get pneumonia or have other issues, they may produce a lot of secretions. You may touch this bottom part, you may touch the side here, but you cannot touch the inside of the tracheostomy tube. That is considered sterile. Now, I want to demonstrate what you are actually suctioning. With my gloved hand, which is appropriate, I can touch the sides turn it to the left, which will unlock it. I'm going to pull it out. I want to show you, this is called the inner cannula. This part right here, that is sterile. The only part I can touch is that white part. This is the part we're going to be taking out, cleaning, and putting back in. To put it back in, you just guide it in the hole gently and turn it to the right to lock it. Now remember, anytime you touch this or take the inner cannula in and out, that could be uncomfortable for the patient, and they often cough. I will tell you that patients who have a tracheostomy tube cough, and it's a violent cough, and sometimes it will startle you, and sometimes they can cough sputum out of the tracheostomy itself. What if this patient coughed and the sputum came out the hole? Just get a washcloth or a clean piece of gauze, wipe it away, all right? So this is just a little bit about in preparation for this skill. I'm going to listen to my patient's breath sounds. He's been coughing a lot, and I asked him if he needed suction, and he nodded, but I have to assess the lungs. So I've got my stethoscope. And remember, what we're suctioning is the tracheostomy itself. This is a mannequin, so I cannot do a full lung assessment, but of course that's part of your everyday assessment, every shift assessment. So I can actually hear the patient with the congestion in the tracheostomy tube, but I'm going to listen up high, above the clavicle, having the patient breathe in and out. I'm going to listen below the clavicle, right and left, and I'm hearing congestion, and I move down. I would continue this assessment like we have taught you previously how to do a full lung assessment. But I have determined that the patient needs a suction. I also, his respiratory rate is 24, which is slightly elevated. And also his O2 saturation is 88%, which is low. Normal is 95 to 100%. So I want to turn on my vacuum to between 80 and 120 millimeters. I also want to turn on my oxygen to 100% should your patient need supplemental oxygen before we suction. This is what I'm talking about. So in this case, this patient does need supplemental oxygen before we suction, because remember, when we suction a patient, we suction air, we suction oxygen out. So some patients will need a little boost before we get started. So I'm going to, let me put my clean gloves on. And I'm going to, I have my oxygen turned on to 100%. This fits right over the tracheostomy itself. And when the patient breathes in, I want to compress. Inspiration, expiration. Inspiration, expiration. Inspiration and expiration for 3 breaths. And now I'm ready to get the procedure started. We'll be demonstrating tracheostomy suctioning. Patients may need suctioning several times a shift. It depends on the patient's individual needs. Tracheostomy care is once a shift. So you don't have to do trach care every time you suction. In this case, the patient needs a suction. I've got my 14 French suction catheter kit, which is about the right size for an adult, smaller for children. Inside, it does contain kit gloves that are not surgeon's gloves, so you may want to get your own pair of gloves. I also have sterile normal saline that I will be opening, and I'm going to put the date and the time on it, because without it, we wouldn't know if this was in pristine condition or not. So today is February the 9th, 2021, and it is 2:20. So the next person that comes in will know that this saline will be good for 24 hours beyond this date. All right, so I'm going to go ahead and open my saline. Let me put it right here. When you open up any device, the cap goes on the table upside down in an area where you're not reaching over this. I'm now going to open up my kit. There should be an end that's obvious. It has a finger hold at the end, kind of dog-eared, so you will know which end to open up. This is the outer covering. I can remove that and put it to the side. Now, this is what you're seeing. The first thing I see is this little object sticking out from the gloves. It's there for a reason. You want to grab that first, pull it out, touch it just by the sides, squeeze it. This is the inside of it because it's going to be plastic lined. This is the bottom of it. You're going to put your saline in here. So I'm going to put my saline box here, reach around, pour my saline. I might go ahead and just cover that up. I'm putting it right there on the corner, leaving myself room to open up. Now this looks like a glove package, and it opens up like a glove package. Inside here are your gloves and your suction catheter. Remember, this is sterile. So I'm gonna undo my folds just like we did on a glove package. A little bit different. I'm gonna first reach the top fold by the edge, open it up, reach under the fold on the next one, and I noticed that, well, it's upside down. I'm not worried about that. All I have to do is rotate it. That happens all the time. I can touch the 1-inch margin. All right, now these are sterile gloves, but they're not surgeon gloves. But if you notice, they're one on top of the other. What I do is, you know, when I put gloves on, I look for the thumb. But I know when I pick up the first glove, I have to touch it at the base of the cuff. So I'm going to pull it up. And of course they're sticky, but that's okay. I'm going to gently free it. Now I'm looking for my thumb, and I think I see it tucked up under there. So I'm going to put it on just like I put on any glove that's sterile. Touching only the inside of the glove. There you go. And actually, this is not a bad size for me. I can manage this well. Some kit gloves are very big. The second glove, I reach up under the cuff. Slide my hand in. I'm looking for my thumb. There it is. All right. Lock my fingers into place. I can touch the inside of this sterile field, but not the outer 1 inch. This looks like a little bag, and inside of it is your sterile suction catheter. This is sterile. Remember, we are putting this inside the sterile tracheostomy tube. What you want to do is you want to have control. So I'm going to wind this around my dominant hand, the palm, but I want to end it up by holding it like this, because this part's got to connect to my suction tubing, right? So at some point, we have to contaminate one of your hands. So I'd rather it be your non-dominant hand because you want control for this procedure. So I think I've got everything to go. I've got my suction on. I've got my oxygen. He's been pre-ventilated with oxygen. I've poured my saline. Now I'm going to contaminate my left hand, which is my non-dominant hand. I'm going to connect just this end to the end of the suction catheter without contaminating my right hand or the suction catheter. I'm going to extend my tubing, and I'm going to check my suction. See that little hole right there? That is where the vacuum's at. When I put the thumb on the hole, it vacuums. When I take my thumb off, it does not vacuum. So suction on, suction off. First, I'm going to lubricate the end of my catheter with the saline, and I can put a little suction on it, and that'll help lubricate the tip. I'm going to go down approximately 4 inches or so. Remember the length of the tracheostomy tube I showed you earlier? We want to be able to suction that catheter tube. So we've got about 4 inches here. My thumb is off. I'm going to take this catheter and gently insert it into the tracheostomy tube with the suction off. The patient is most likely going to cough. Yes, sir. All right, we're going to put the suction on intermittently, and we're going to pull the suction catheter out slowly. You don't want to suction for any more than 10 seconds. I'm noting the color of the secretions, any odor, the consistency of it. Is it thin or is it thick and sticky or tenacious? And the volume. Doesn't look like I got a whole lot of sputum out of there, so I'm going to go back in. Yes, I can reuse this because it's the patient I'm using it on. So I want to come back over here, put my suction on and rinse the catheter, come back out, thumb is off, insert the catheter into the tracheostomy. Good cough, good cough. Now, for no longer than 10 seconds, I'm going to slowly pull the catheter out. And this time I've gotten a lot of secretions. The patient happened to cough a lot too, which helped. And I'm monitoring the patient, and I noticed that the O2 saturation is back up to 95%. I said, Mr. Smith, how do you think you're cleaned out pretty well? And he says, yes. And I am done with the suctioning procedure. Sometimes you have to watch your patient carefully. What if you suction twice and he still needs more suctioning? Consider giving him more supplemental air. If the O2 saturation is still remaining low, you may want to give him another couple of breaths before you proceed with the procedure. Now, how would you do that? If you were the only one in the room, I would gather this up in my hand. I would grab the ambu bag with my already contaminated left hand. I would place it over the tracheostomy tube, and I would go inhale, exhale, inhale, exhale, inhale, exhale. Right. And then I'd go right back to the procedure and suction him again. Some patients need a lot of suction. Remember, this is an airway. Remember the ABCs, airway, breathing, circulation. If I don't get this airway clear, it could be deadly for the patient. I've determined that this suctioning was successful. I reassessed his breath sounds and they are now clear. We disconnect this. This is all trash. This can be looped up and saved for the next suctioning. I would turn off my suctioning and my oxygen and make the patient comfortable. We're now going to be performing tracheostomy care, which has to be done once a shift. Once a shift is fine. Suctioning may require more than one time. And what I've got is my items, or my equipment. I need my saline, which I used earlier and it's still in date. I've got a pair of clean gloves, and that will be used to remove the outer dressing before I even clean the tracheostomy. I've got my tracheostomy care kit. Always read what the items are inside the kit. In this case, I think I can use the gloves that are in the kit. If you don't like kit gloves, bring your own. This is a Velcro necktie. These ties that came in the previous kit I used, they're fine, but they're not as secure as the Velcro ties. So that's why I've got that. I've got a pair of scissors just in case I need a pair of scissors, and I've got a towel. And you will see why I'm using this towel. This is a clean, not sterile towel. Before I even open up the kit for tracheostomy care, of course I gather all of my supplies, but I'm going to apply a pair of clean gloves. And I do that because I can remove this outer dressing. Actually, if you walked in the patient's room and they needed this changed at any point in the shift, all you have to do is pull the dressing out and put a new one in there. You can do that without opening up any kit. I did want to show you that this is what we call split gauze or drain sponge, and you'll use a lot of these throughout the shift, but I want to go ahead and remove that before I even get the procedure started. I would want to wad this up in my glove, take my glove off, and then we're going to do hand hygiene. We'll perform my hand hygiene. We're going to be doing trach care, but I want to talk a little bit about the kit. I mentioned this earlier, but every hospital has their own brand of tracheostomy care kits, and this is our brand here. This is what you have as a student. I want to open up, when you open up a sterile kit, you want to only use your fingers on the opening. See where it says peel apart? Open up this kit. You can only touch. I'm going to take the whole thing off. Now, once this is open, you can only really touch the edge. That is it. So this really challenges your sterile technique. Now, when this kit is packaged in the factory, they package it in a way where they want you to use things that are in the order of their appearance. So the first thing I see looks like a glove. These kit gloves will challenge you. They're just kind of folded up in there. Also in this kit, we see two compartments here. Actually, there's three here, but there are sterile gloves on top, which we put those on first. We also have a sterile pad underneath, which I'm going to improvise here. That's why I've got a towel here, and you'll see exactly why I'm going to do this. But the whole object of this is that we clean and replace the inner cannula without breaking sterile technique. The rest of the procedure is clean technique. All right. Before I get my gloves out, remember I told you about a towel. I'm going to improvise here because I want to set up a sterile field, but obviously I don't have a sterile field. I'm going to use this towel. This is a clean towel. I'm going to drape over the patient's chest, but not on the tracheostomy tube. Remember, we can't occlude that. I have to remember, though, that I can't put anything sterile on this towel, but this will allow me some flexibility with the skill. So I'm going to pick up the first glove that's on top. I'm going to pick it up by the inner cuff. And these are kid gloves, and they love to stick together. So you have to be very, very careful when you're pulling this glove out. All right. There we go. So I'm going to step away, and I'm going to put this, it's a vinyl glove. They're not flexible at all. So I put the first glove on. It's a little big for me, but I think I can make it work. The second glove, I'm going to go under the cuff. Find my thumb. All right, I missed a finger, but I can fix that. I don't want to go too close to my wrist. I'm only touching sterile to sterile. I'm going to lock my fingers into place. The next thing I see, and remember I put the towel on the patient. This is what they call a patient drape, and normally you might put that on the patient's chest, but we've got some supplies in here that we have to arrange. So what I'm going to do is use this sterile drape as my sterile field. So the only part I can touch with sterile gloves is the inside of this box. I cannot touch the edge, I can only do this. So I'm going to move this right here. This is my sterile field. I'm going to put plastic side down. This is a shiny plastic side that goes against the table. I'm going to place that just like this. I can only touch the inside. We now have an imaginary 1-inch border. All right. Now, I go right back to my kit, and I'm going to pull out your supplies. We have two pipe cleaners. I'll show you what we use those for. 2 cotton tipped applicators. Those 2 are used for cleaning. Our little scrubber brush, which is used to clean the inner cannula. I have a new dressing that I'll put around the trach that has a split. I don't need that right away, so I'm going to put it here. Now, when I place these items on the sterile field, it has to be within that 1-inch border. I also have some extra gauze. This gauze is not split, so that's used for cleaning. Then we have some ties that I may or may not use. That would be done at the very end. I will show you how to put the Velcro device on, but I'm going to put that right over here maybe. Let me rearrange that. Put that there and there, all right? So, now let me look back at my little, and I'm actually going to move this over here. And you see 3 compartments. I'm going to put some gauze. I want to moisten a couple of gauze. So I'm going to take 2 of these that are not split, and I'm going to kind of wad them up and put them in here, all right? I've got a couple of dry ones. And next I'm going to have to contaminate a hand. Okay, now I want to point this out. See the ties that have touched that 1-inch border? I'm very well aware of that, but that is part of the procedure that's not going to be considered sterile, and you'll see what I'm talking about. Plus, I may not even use those ties, all right? So I'm going to come over here. Now, I can't just reach over this and grab my normal saline. That wouldn't work. What I like about these little tables is you can kind of move around the table itself. So I'm going to reach around. I'm going to keep my dominant hand in control. Now I'm going to grab and open my saline, which you could have opened before the procedure had begun, which I would encourage. So I'm going to loosen the top, put the top upside down. Now remember, I've contaminated this hand. I'm going to pour some saline in here. Saline is the only thing we use to clean a tracheostomy with. We don't use peroxide anymore. And also I'm going to put some saline on this gauze that I had for cleaning as well. I think I am now ready to take the inner cannula out. Now remember, this hand is contaminated and I can touch the outer part of this inner cannula. I'm going to turn it to the left to unlock it, pull it out, and I'm going to drop it or either place it in the saline, which I'm just going to hold on to it and place it in the saline. With my right hand, I'm going to grab the sterile scrubber brush and I'm going to insert this in here and I'm going to clean it. You can see all the way through. We're going to clean it. If tracheostomy cleaning is done like it should be, there should be a lot of secretions on here, but sometimes it is. Just depends on the individual patient. I can also use this brush to clean the outside. I'm going to make a dirty area. This corner right here is where I'm going to leave, or either I could just leave it in the saline. I'm going to switch hands, and I can do this because I'm almost done with the sterile part. I'm holding only the white part. I want to rinse it off, so I'm going to grab my saline and rinse it off, tap it dry, and I'm going to put it right back in the patient. Carefully lock it into place. You okay? All right. The sterile part is over. So now, using clean technique, I'm going to clean around the stoma and I'm going to clean up the plastic and around the patient, and then we'll be pretty much done. So the first thing I'm going to do is I can use both hands now, clean technique. I'm going to wring out the excess saline. Now I'm going to clean the stoma. This is considered clean technique. So I've moistened two gauzes with normal saline. I can touch this plastic part here. What we're cleaning, and I'm going to pull this down a little bit, is this hole, the stoma, tracheostomy stoma. I'm going to do one wipe at the bottom and toss it or put it on my trash pile. I'm going to grab the second one and I'm going to pivot it the opposite direction and clean the top part of the stoma. This is what I'm going to chart later. What does that stoma look like? I don't see any signs of infection, redness, or skin breakdown. That's what I'm charting later. The stoma is clean. Now I'm going to grab my other pieces of equipment. These are my Q-tips or cotton tip applicators. I can use that to clean around the stoma if I had any area that I wanted to spot check here. How you use your equipment is really up to you. You just want to make sure you clean the stoma. I would get a clean one to do the top part. All right, the stoma looks great. Now the plastic part, let's say the plastic part had some secretions in the little cracks here. These are pipe cleaners. They are sharp on the end, so you want to fold it over. And that way you can go in here in the soft fuzzy part and clean in between these little crevices. Right? These can be used on the stoma as long as you fold it over and don't use the sharp edge. But I now have the plastic areas clean and looking good. If you clean them very well, then there won't be any odor, and you don't want your tracheostomy to look nasty or soiled. So I've got the inner cannula cleansed and put back in. I also have the plastic apparatus clean as well. The last thing I'm going to do is put this dressing on, our split gauze. The split part will go up, so now this can be very hard to do, and it's uncomfortable for the patient, so do one side at a time. Just gently lift it up and do the other side. And I like things to look nice and neat. Nobody wants to see an old ugly looking dressing, so you want to make sure that you've got this dressing looking nice and tidy for the patient. Usually the last thing you want to do is to change your ties. Another reason that we want a dressing over the stoma is this is all about body image. This greatly alters a patient's appearance, and you want to be empathetic and make sure that you've got the stoma concealed as best you can and that it looks nice and clean, and you take pride in your dressings. Look at it from a patient's perspective as well. Now, I mentioned that I was going to replace these ties. See how they fray? We don't want anything that has a fray to be inhaled. So that's why most institutions want you to use this device, which is a trach collar using Velcro, and I'll show you how that works. I've got an assistant here with me because I'm not putting a new set of these ties on. I'm going to put the Velcro tracheostomy collar on. So I have to have someone besides myself to hold this in place because I don't want the patient to cough their trach out while I'm removing it. So I've got my scissors here. I'm going to cut the old ties off. These should slide out. Hopefully they will slide out easily. These have been on a little bit. You can see the problem with these. They fray very badly, and those are just something that the patient could inhale. I'll remove the other side. It should just pull free. There we go. Cut it here. Because most institutions don't want you to use that type of securing. Now I'm going to put what this trach collar has is 2 little strips of Velcro on each side. This is an extra piece that you can use to adjust the size of it to fit your patient. So what we're going to do is we're going to first, this is not sterile, put this behind the patient's neck. All right. And you want to make sure that you've got it in a way where the Velcro will fold backwards, right? This side that doesn't have anything on it is what I'm going to attach this Velcro stay to. So I'm going to adjust it and I can do that once I get it on the patient. I'm going to put this new Velcro piece right here. All right. So what I'm going to do is carefully, and this can be kind of tricky, thank you, Dave. I'm going to lift this. I have to go up under and thread it through the hole, and this can be tricky. I know, sir. I'm so sorry. There we go. All right. You can rearrange the dressing if necessary. So I'm going to Velcro and secure that side. Then I'm going to come around. All right, and now I'm going to attach the other side, and my assistant is going to hold this down while I thread it through. And if I told you this was easy, I would not be telling you the truth, because this is tricky. Yes, sir, I'm sorry. But we've got to get it up, under, and through. All right. Thank you, sir. I'm going to bring the collar around, and I'm going to adjust this and attach it. You want to leave at least 2 finger breaths. You don't want it tight, but you don't want for it to be floppy loose. But you want it to be where if the patient did cough, it would stay secure. And this is just the way we need it. And then this is tracheostomy care. And this dressing can be changed as often as necessary. The collar can stay on for several days, but once it gets soiled, it needs to be changed. It doesn't need to be changed every time you do trach care. And this ends the procedure. And now I'm done with the procedure. And you're not done till you tidy up the room and make the patient comfortable. So I've taken off my gloves. I'm going to get a new pair of clean gloves, and I'm going to clean up the mess that I made. I want to empty out that saline. All this is trash except your normal saline. As long as there's some saline in there, we can use it. And I have it dated from a previous skill. All this is trash. There's nothing sharp in here, so I can gather it up. My old ties, my scissors go back in my pocket. My saline I can save for later. This goes in the trash. Now I'm not done yet because I want to make sure that I clean this table off. Remember, the patient eats off these tables, puts their phone on here, puts a book or something there. So you want to make it nice and clean. I can tell you from years of experience and having been on the end where my family was in the hospital, you want things neat and tidy. Even if you have a patient who's very ill, everything matters. Don't forget that. So I'm going to put the side rail back up for my patient. Put the bed back in the lowest position. I'm going to raise the head of bed in case I have it too high for the patient's comfort. Most patients don't like to stay in the that high of a Fowler's position. So I'm going to lower the head. And the patient said that's good. I don't need the towel anymore. That would go in the dirty linen. I would save this oxygen for a later time. You can just loop it here. And same with your suction catheter. That would all be at the head of the bed if you needed it anymore. I would put the table back. Whatever belongings the patient wanted here, I would place on the table. But just remember to leave the room cleaner than when you entered it.